Hello everyone! It is Brooke coming back with an update. I feel like I haven't spoke to you all in forever, so I wanted to make a video to kind of clue you in on everything that's going on with me right now. So yesterday I had my pre-op appointment, and kind of just went in and they went over all of my concerns and kind of just reminded me and kind of familiarized me with what to expect for the day of surgery. And they also actually scoped me. So they wanted to take a look at my vocal cords to see what the condition of them was before surgery, to see if they were both functioning well and how open they were, and the functionality of them, which turned out to be good. So they put a spray, like a nasal spray with a machine. It was kind of like an airbrush machine, but for nasal spray. And they stuck it in both sides of my nostril. They like spread my nostril open and then stuck the sprayer inside of my nostrils on each side, and then told me to sniff in on both sides, and it completely numbed my nasal cavity. So it was a really interesting and uncomfortable process, but it was not necessarily painful. I mean, it didn't feel good, but it kind of just, it stung a little bit, and it was weird. The scope was really long, and they stuck it down my right nostril, and it went down through the back of my throat, and I guess that's when they were able to visualize my vocal cords, and all is functioning well there, so I guess that's good. And they said everything looks good, so I guess that's a positive note for all of this. So my vocal cords are good for now. Hopefully they stay that way after surgery. Some of the questions and concerns that I went into the appointment with were, my first question was, for my radioactive iodine treatment, I am supposed to be like quarantined for 3 to 5 days, and they wanted to send me home for that, and I don't really feel comfortable doing that. So I wanted to know if there was any chance or option to be able to go to like a facility or stay in the hospital, or what their recommendations were. And actually they told me to go stay at a hotel. I'm not sure how that works, because I'm guessing I would have to notify the hotel and let them know that I'm going to be staying there, because I will be radioactive and I can't have any contact with anyone. And then I'm sure that they would have to bring in like a special cleaning crew afterwards to do proper cleaning once I leave. So I have to check in on that a little bit. And then another concern that I had was my scar. So initially I was told that my scar was just going to be from like over to this side of my neck, over like all the way to here. And then I joined some thyroid cancer support groups, and I started seeing like these hockey stick type of scars for people that had lymph node involvement. So they would like start over here, and it would hockey stick up all the way to their like back behind their ear, and that's not what we had discussed. So I was like, what is going on? Am I gonna have this like huge hockey stick looking scar? If so, do I need to bring in a plastic surgeon to sew me up so that it's not as, you know, visual or easily visualized? So I learned in my appointment that that's an older technique, that some of the older docs do that, but my doc is a little bit more modern, so she's gonna try to do it going further this way. So you're, instead of doing the hockey stick, you have a wider scar down here, but it's straight, rather than having it like go all the way up your neck. So this can be kind of like a bigger opening, so they can pull my skin back and get all the way up there to get everything that they need to get. So I guess I feel okay with that. I'm gonna have a scar regardless, and that's the least of my concerns. I just want to make sure that they're gonna be able to access everything that they need to be accessing while they're in there for surgery. And then I also wanted to address how, once my thyroid is taken out, how is someone dosed for their thyroid medication? So obviously after the surgery, I'll have to be on thyroid medication for regulation of my endocrine system for the rest of my life after this. So I wanted to know, how do you dose someone once their thyroid is out? What do you base that off of? And it's based off of weight. So I'm concerned with this process about losing and gaining weight, mostly gaining. I'm sitting out here with my son and he's riding in the yard, so excuse me for the interruptions. Bubby, you gotta stay over here, okay? So I had questions about that because I just wanted to make sure, like, how do you level that out? How do you figure out what is the best dose for a person once you take their thyroid out? Because their thyroid is doing that job. How do you determine what their body is needing and what their body's used to get them back on a normal regimen? So it's based off of weight, and then you see how it goes throughout the months. If you're having issues, they redose you, you know, trial and error basically. So I am comfortable with that. It's a little scary because it's unknown how your body will react once your thyroid is out, but there's nothing you can do. You just have to go with it. So I'm going with it. And other than that, I feel pretty confident about the surgery. I'm not nervous for the surgery itself. I'm nervous about the aftermath of the surgery, so the complications that come once everything is taken out. There's just so many things that can be affected, so I'm a little nervous about how my body's going to respond once all of these things are taken out, and also concerned about all of the little things that can get nicked in there during surgery and all of the things that can be affected. So that is what is making me nervous, not the actual surgery itself. So today is Tuesday. I am, oh my gosh, this is crazy. I haven't even like thought about it because life is happening all around me, and I haven't even allowed myself to slow down. But my surgery is on Thursday. It's Tuesday. I'm like just realizing how soon it's going to be happening. It's going to be life-changing, and it's really hard to like grasp the fact that after Thursday my whole life is going to change. I mean, it already has with the cancer diagnosis, but now it's like, oh my goodness, this is really real. So I'm trying to get my house ready. I'm trying to get everything situated for my kids, have plans for babysitters and grandparents and visitors, and I have so many people offering to come and help out, which is so nice. I appreciate it so much, and will take advantage of everything that I can. So yeah, I think we're just gonna have to take it day by day to see how I'm feeling. My surgeon said that I should be feeling less pain in about a week. I'll feel sore for up to a week and have, you know, discomfort when bending my neck. They told me after surgery I'll want cold compresses on the front side, and then since the position of the surgery is going to be a little strange, they're gonna have my neck kind of bent back during surgery. They said that I can have some discomfort in the back of my neck, and for that you put warm compresses on there. So with that being said, I've gotten like ice packs, and I just ordered a warm rice bag that I'm gonna use for the back of my neck for the first few days once I get out of surgery. So that's really about it. I don't know. I have so many mixed feelings about it. Obviously, I just want this to be over and I want it out. But I'm nervous. I'm scared. I feel confident in my team and my doctors and all of that stuff. It's life altering. How can you not go into it and be nervous? So just trying to stay positive and work through it day by day and use everyone's support, all of the amazing support that I've gotten this whole time, and just kind of embody it and take all of the positive vibes and prayers that everyone has been sending me. I've had patients send me amazing little gifts that have literally brought me to tears, and I'm getting so many cards, and friends are sending me, you know, sweet stuff. I've had people raise money for me by selling little cancer ribbons. I mean, the community has just been amazing through this whole process, and I know I say this like on every video, but I am so thankful. Like, in that aspect, I couldn't feel more supported. Everyone has been amazing, so thank you everyone again. And I do have a little something to show you all that is pretty cool. I know some of you have been asking about the egg retrieval. I had that done on a Friday and I went back to work on Monday. So for those of you who don't know, I do work at a fertility clinic here in Cincinnati, and so I obviously went there for my egg retrieval, and my staff and all of my coworkers were so amazing and so supportive. They have flowers waiting for me in my little triage area, and everyone was so supportive. So I love working, and I love who I work with, and I love what I do. So I went back to work on Monday and went full swing. So I'm a scrub tech, so I went back into scrubbing on Monday, and it was kind of not a good decision. I was really sore, and my job in the mornings, I'm running around constantly, grabbing patients, changing them, taking them in to do the procedure, and then running them out and then flipping the rooms, and it's just a very fast-paced type of position. So I overdid it on Monday, and I was fortunately off on Tuesday, so I went home on Monday night and rested the entire night practically. I just wanted to sleep. I was sore, my belly hurt. So Tuesday I was off, and then Wednesday when I went back I felt much better. So that was good. But on Monday when I went back to work, they had this little gift for me. I got it a little dirty, but oh, it's windy. How cool is that? Those are my eggs. Isn't that amazing? Oh, they're so cute. Oh, it's so fun. So my coworkers were able to get me a picture of my eggs, so they're like hanging on my fridge. It's crazy. It's a crazy experience to go through all of this, but it's so cool. It's neat with the processes that I'm having to go through, and I'm, like I've said from the very beginning, I'm just trying to look at the experiences in a positive way, and do the best that I can with the cards that I've been dealt. And it's all moving so fast, and I'm just hopeful for a fast recovery and an easy recovery and a painless recovery. So thank you so much to everyone who has been following along. I'm so grateful for everyone that has been involved in this process with me. I hope you continue to support me through this. I don't think I'd be dealing with it as well as I am if I didn't have you all behind me. So thank you so much again, and I will see you on surgery day. So I'm planning to vlog the morning of, and then I'll have some family members or Matt get some footage before and after surgery, and then once I get home. So I'll stay the night in the hospital on Thursday night, and then I should be discharged Friday afternoon as long as everything goes well. And once I get home, I'll have someone take some footage, and if I'm feeling well enough, I'll try to upload Saturday or Sunday. So I will see you all then. Feel free to send me a message to check in if you would like to. I'll do my best to respond. I've been getting a lot of DMs, so thank you for the continued prayers and support, and I will see you all soon. Bye!